Alright, so let's begin the show. Delhi's air quality on Friday, November 24th morning went to very poor category with the air quality index, which is AQI, above 350 according to the System of Air Quality and Weather Forecasting and Research. Now, the pollution levels in Delhi NCR has brought about a grim consequence, a rise in emergency hospitalization. Exactly, that's right. As the air quality index worsens, there has been seen an adverse health impact on the residents, which is totally undeniable now. And not only does this pose a severe threat to people's well-being, but it also burdens them with substantial out-of-pocket expenses. So let's discuss about how can you cover up these expenses in your health insurance policies and what will happen if you do not have one. With me today, I have Dr. Mayanka Lodha Seth, Pankaj Vashishtha, CEO and co-founder, Policy Insure. Good evening and welcome to the Money Show. And before I get into the health insurance nitty-gritties, I really want to understand from Dr. Mayank about the kind of grim impacts that we are talking about and what kind of health issues, specifically talking about kids and senior citizen. Post-COVID, we've been seeing that, there are cases of long COVID and there have been cases for, related to your respiratory system. But looking at the AQI levels, and we have this air pollution problems in Delhi and, the region around that, especially in North India, coming up every winter. How severe is it this time?
Actually, this is Dr. Mayanka Seth, and I'm a lab director, pathology to Redcliffe Labs and Center Group of Labs. So yes, air pollution definitely poses a great threat. And as you can see on the screen also presently, more than 300 AQI is hazardous to all, whether healthy individuals, children, teenagers, or all those who are come in the sensitive groups, that is, who have pre-existing diseases or who have exposures for a long time in this air, like outdoor exposures, and having the high ventilatory rates. So definitely, yes, the higher the AQI, more are the hazards. And if we talk about the hazards, they fall into two categories. One is short term and others are long term. And there's a long list included in both the categories. In the short term health hazards, what we experience commonly and we see commonly, we can have irritation in eyes, we can have shortness of breath, there can be chest pain, you can have skin allergies, skin infections, there can be difficulty in breathing, what we call shortness of breath, etc. So these are the short-term effects of high AQIs. In the long-term effects, they are very major health hazards. And the main in that series is cardiovascular disorders, mainly stroke. Then there is statistically relevant evidence that high frequencies of heart failures as well as ischemic cardiac diseases are associated with hazardous level of AQIs. Amongst others, long-term effects, even cancers, mainly bronchogenic carcinomas, that is, cancers arising in the bronchogenic tree, they are caused by air pollution. Even liver, kidneys, GI systems, and neurological systems are also affected by higher AQIs. There is a definite association of worsening neurodegenerative diseases like Parkinson, Alzheimer's, and other causes of dementia. The most and the commonly found diseases are, of course, the respiratory illnesses. So you see increased frequency of COPDs, that is chronic obstructive lung diseases. You can see aggravated asthmas. You can see, increased needs of medication in all ILDs, that is interstitial lung diseases. The need of oxygen requirements becomes much more with higher AQIs as compared to when the air quality is excellent. So all these hazards are definitely there with higher AQIs. And kids, when we talk about children, they are very much affected, even more than adults. So in kids, right from the conception problem, there can be infertility issue. First of all, even the conception, issues are there. Then, when pregnancy is continued, many adverse pregnancy outcomes like premature birth or low birth weight babies, IUGR. Then there can be increased frequency of children with birth defects. So all these things are seen even in fetal period. And when the child is born, there are chances of stunted growth. The growth is not normal. And as kids, kids experience a lot of irritation, cognitive disabilities, inability
Start
to
small, but
focus.
then if kept if you've kept it without consultation and left it without monitoring it, this can develop into severe illnesses and diseases. Pankaj, my question to
Definitely.
you is, if at all you have a health insurance policy in place, you're good, okay? Because we are seeing a lot of hospitals, especially in Delhi NCR region, have come up with emergency centers looking at the kind of cases which are suddenly coming up. Not that they were not expected, but then yes, the kind of issues and the rate at which it's happening, it's somewhere needed that they have a casualty and emergency center in place. Now, I want to understand the crucial role that a health insurance policy will play. Suppose if you are a victim of this air pollution, okay, and you never had any kind of respiratory, mainly we are seeing these kind of complaints coming up, which is why I'm saying any respiratory issue. Will you be denied a health insurance cover if at all there is a case of hospitalization?
Frankly speaking, as far as the health insurance is concerned, there's nothing very specific which is covered. It is in general a comprehensive health policy covers each and every hospitalization which is due to any illness. There's no cover right now in India which is available which specifically covers anything which is related to the pollution-related diseases. But it is always advisable when you are covering with a normal health policy to take a critical illness cover. It's a very separate cover which comes with, which is given by a normal insurance company. So this critical illness cover normally covers very specific respiratory illnesses that can be linked to the air pollution. So I think that is something which plays a very, very important role in what kind of a insurance or health insurance which you are choosing. But the way today the air pollution is going on, I think it's important for every individual to take an additional policy of the critical illness cover, which will obviously take care of any critical illness which a human or individual will have due to the air pollution.
But Pankaj, will you be denied health insurance coverage? Because if assuming you already have a comprehensive health insurance plan, okay, and if anything happens to you which is triggered due to this air pollution, will you be denied the claim? Are those bases can that be a base for an insurance company to deny a claim?
No, that cannot be the basis of denying claim by any insurance company because a normal illness is obviously covered by each and every insurance policy. Only there can be an exception only in a case where a critical illness happens and there's a waiting period. For every insurance policy, there's a waiting period of 3 years as far as the critical illness is concerned. So critical illness, if it happens due to the air pollution or due to any other reason before 3 years, then most of the insurance policies don't cover it. But in normal circumstances, any illness which happens, which is not a critical illness, would be covered by any health insurance policy.
Okay. Pankaj, quickly, I also want to understand the kind of difference in coverage, that you might see if at all you go for a claim and you have maybe say a family floater, a group insurance and an individual health insurance policy. Okay. When you go out to claim under these policies, what could be the difference that you might witness?
See, group medical aids are generally taken by the companies which taken for their employees,
Sure.
where normally a sum insured is very, very less for each employee, depending on what is the kind of role it is there and kind of a designation it is there. So normally it is very advisable to every individual that they take an individual health policy which can cover most of the medical expenses, which has got a higher sum insured. Because what we have seen over the past years and a lot of things happened during the COVID that a lot of people who went into COVID were not properly sum insured covered. And major reason was that they were covered by the corporate policy, which is called the group mediclaim. So over a period of time, and I think it is very advisable to every individual, even if you are covered by your company, it is good if you take an individual health policy, which should be a minimum of 10 to 15 lakh rupees covers your overall medical expenses.
I'll come to you because it's very important for one to understand that okay, you have a health insurance in place, but then it's also important for you to take care of your health because these kind of issues which we are seeing, and as explained by you also earlier, will have a greater and a graver impact on senior citizens and kids. What all on a precautionary level would you recommend our viewers, in terms of going out in this environment, and maybe safety triggers that you might want to apply to your lifestyle?
Yes, it's definitely important that. Sorry, I guess the question is to me.
Yeah, Mayanka. Yeah.
Yeah. So it's definitely important to be very careful whenever AQIs are in the hazardous level. You need to stay indoor as much as possible because even running, jogging, doing activities in outdoors with this high AQIs, all activities will cause hyperventilation. They will increase your respiratory rate, and you are more prone to be affected by PM 2.5, that is 2.5 micron particles, which are very hazardous, and even ground level ozone can be very hazardous in these cases. So when AQIs are high, it's better to stay indoor. The schools also, some schools in Delhi already have taken this measure that they don't prefer children coming to school when EQIs are high. And you can have you can select routes which have lower pollution levels, if at all traveling is important. Then, of course, taking care of your health and screening and timely diagnostic test if you have symptoms, and attaining timely medical advice in case of short term, even if you have short term problems, is definitely important so that you don't have complications further on. So these are the immediate measures that can be taken. But of course, in the long run, the government and administration need to take care of the exhaust fuels from the cars and agriculture, that is the parali would be listen every day. All these administrative measures need to be in place. We should see Shanghai, it had AQI more than 500, not very time back, but nowadays Shanghai has AQIs very low down. So these were mainly due to the administrative measures that people could
Right.
breathe good air. Yeah.
Okay. So, the bottom line is prevention is better than cure, but just in case, if it goes to that level where you need a cure, just make sure that you have the right kind of health insurance in place. And as explained by Pankaj, you really need to have a critical illness cover as well. Thank you so much, Pankaj and Mayanka, for being on the show and helping our viewers with this today. On that note, let's take a quick break, but then post that, we'll be joining our viewers live on the show and getting their portfolio strategies analyzed. You can WhatsApp us your question, and you can also email us your question just in case you are watching our show and want to send us your query. See you after this break.